So first we're going to do a little bit of muscle work to kind of loosen up the back, and we're just going to rock the body a little bit and move through each vertebra. So this allows us to get the spine moving, oxygenate the cells in the back. And then we're going to do some individual muscle fiber work down here in the lumbar spine. And we'll go back on the other side. It's pretty tight right there. And then we'll move both sides of the spine at the same time. And then we'll go do what's called rolling, which is to just warm up the area and the muscles. So this is the quadratus lumborum, which is one of your low back muscles. And then we're moving up through the thoracic spine. And then we'll do that coming up the other side here. Again, this is your quadratus lumborum. This is your lower trapezius muscle. And these are your rhomboids up here between the shoulder blades. So this is called tapotement. It's to get the blood circulation going through here. So we'll come back and do some cross fibers. Loosen up all the way up through the thoracic spine this time. And then doing the left side. Pretty tight down here in the low back. And we're just going all the way up the erector spinae muscles, doing some cross fiber and loosening them up. And now we're just moving back and forth through the erector spinae muscles, using my fingertips all the way up the spine. So all these muscles are connected all the way from the low back all the way up to the neck. And there we go. It's all starting to warm up and get looser. So now we're going to go through your upper trapezius muscles. Loosening up the upper shoulders. And then move on up through the neck. And we're doing some cross fibers on the upper trapezius muscles. And then going back through the spine again, loosening it up. Just rocking back and forth, nice and gently. Then we're going to lift up this hip a little bit and move through the low back. And do the other side. And then I'm going to grab onto the spinous processes of the spine and just wiggle them back and forth. You can probably feel that going deep into the spine, getting some more movement. So mostly what we're doing is improving the circulation, reducing the muscle spasms, finding these like really tight areas right here in the thoracic spine. Just rocking them back and forth until they loosen up. Going back on the spinuses again here. Moving each one back and forth. So sometimes where one doesn't feel like it's moving, I'll spend a little more time moving that back and forth. Then we're going to move down to the legs. Do the same thing, warming up the legs, up to the side of the glutes, down the back of the leg, down the calves. Your calves are very tight. And moving over to the other leg, getting that calf moving. And coming up on the side of the glute here. And we'll do some more cross fiber in the low back where it's really tight here. You can probably feel how tight that is right there. And then we come over onto the left side. Same thing, walking all the way up through the erector spinae muscles. That one's just really snapping a little bit. So I'm going to lower my table a little bit. And this way we can come through and see if there's any joints that need movement. Good. Okay. Bring the table back up. Good. So now we're going to use the adjustor. The adjustor has two heads that come up the spine. So we're just moving up through each vertebra. Getting each one moving. And sometimes if you listen to the sound, you can hear which ones are more stuck than the others. It's almost like knocking on a door. Okay. Now I'm going to change the head on there. So now we go to a single one. So now we're going to go for the rotations in the vertebra. So with this one, we only go to the ones that are rotated, not the entire spine. This is your fifth lumbar vertebra. It's the last vertebra. This is the sacrum. And then we're going to come over to the left side. And coming down to the bottom of the thoracic spine and into the lumbars. This is your SI joint right here, that's a little tight. And that's good. And we'll come up to the occiput, and we'll do a little lift on the occiput. Good. And then we'll come through with the percussor. Percussor is very good for increasing circulation. And we just glide all the way up the erector spinae muscles. And we're going to turn it down a little bit so we can go a little deeper. Hear that low rumble? So sometimes if you listen real close, you can tell which areas are really stuck because it has to work harder. So we're going through the sacrum and the iliums. And then we're going to come up all the way through the lumbars. Now we're into the thoracic spine here. So I just put in the pressure until I meet the resistance, and I just hold that. So this one will stay on a little bit because it's very stuck right here. And that's already starting to move better. And then we'll come up through the upper shoulders into the traps. And then we'll come down to the back of the leg on the thigh. Loosen that up. And then the other back of the leg. So when you sit a lot, the leg muscles get short and tight. So loosening them up takes a lot of stress off the low back. And then we're doing the calves now. And then we'll go to the bottom of the feet. Most people really love that because it really works the reflex points in the foot. And then we'll use the percussor on the side of the leg. It's where the tensor fascia lata is. It gets very tight. And loosen up the other side as well. Then we're going to turn the speed back up. Now we go very light again. Just get the lymphatics moving. Loosen up the shoulders. And I'm following the length of the muscles. So this is your middle trapezius muscles and your rhomboids. This is your upper traps. And then we can also do the base of the neck, or at the base of the head here, just really lightly. It usually feels really good. Come on the shoulders. And move to the other shoulder there. Okay, now we're just going to do a little bit of laser. Now normally we do the laser skin to skin, but we're just going to do it through the blanket here because photons are the smallest particles It just takes a little bit longer to go through. So we usually increase the amount of time by twice. So this laser is a medical grade laser, and it's 5,000 milliwatts. So it's 1,000 times stronger than the typical laser. So it doesn't take that much to get the benefits. And the benefits are, it's FDA approved for pain and inflammation. So we're just going to focus on the low back, where a lot of people have pain down here. And then just go straight up the spine a little bit. Then we're going to come all the way to the base of the head again. These are where the muscles attach from the neck. So most people get really tight and sore right below the back of the head. These muscles here, the neck extensors. And that should be good. And we're just going to kind of rub that out again a little bit. Okay, and just rock the spine a little bit again. Alright, that should feel a lot looser. You should feel more relaxed, probably ready to take a nap.